Hey guys, so today I'm going to be teaching y'all how to do a central line dressing change. This is a sterile procedure, so the first thing that you need to do before you come into the patient's room is gather your supplies. You want to have a mask for yourself and for the patient, and you want to have your dressing change sterile kit here, central line dressing change kit. If you were not to have access to this, then you would just gather the supplies that you need aside from that, but thankfully everything comes nice and neatly packed already for us in these kits. So I'm going to come into the room, I'm going to perform hand hygiene, I'm going to put clean gloves on, I'm going to say, hey, I'm Caitlin, I'm going to be your nurse today, can you tell me your name and date of birth? She tells me. I'm going to explain to her that I'm doing a central line dressing change on her. She says it's a-okay, so I'm good to go ahead and move on. So with my clean gloves on, I'm going to have the patient turn her head away from the insertion site because my central line is on this site. And you will see that when you come in, this is going to act as your skin, okay? So this is your dressing here, this clear Tegaderm. This is the only thing we're changing. We're not changing, do not take this flesh colored tape off because we're gonna act like that's your patient's skin, okay? All right, so the next thing is we're gonna go ahead and put a mask on our patient. These patients don't really have ears, but we can pinch it around their nose. And then I would put a mask on myself. I'm not going to put a mask on for the purposes of this video because you'll have a difficult time understanding me. But no, for checkoff, you do have to put a mask on your patient and you have to put a mask on yourself, okay? So I'm masked up now. I have my clean gloves on. Now I'm ready to take my dressing off. So what I'm going to do is I'm going to peel each corner of my dressing, and I have gloves on for this. And I'm going to make sure that I'm not touching the site where that central line is going in because I do not want to contaminate that, okay? That's what we're trying to keep clean, is this blue site and all this skin around it. All right, so the next thing I'm going to do is I'm ready to get sterile. And I'm going to, while I pull that dressing off, I'm going to be assessing. So is there any redness? Is there any drainage? Is there any swelling at the site? And if so, you would have to document and notify the provider. And the next thing that's super important that you do have to verbalize for checkoff is we want to look at the measurement and see how much catheter is exposed. So this should be documented in the chart by whatever physician or advanced care practice nurse put this in. And the reason this is so important is because if you were to have more catheter exposed than what was documented initially, then this catheter is more than likely not in the appropriate place, and we could be infusing medications, blood, anything into the wrong place, and that's a really big deal, and we would want to notify someone and not use that catheter until it was fixed, okay? So now I'm ready to get sterile. I'm going to get my sterile gloves out. And I have took my old gloves off and I've washed my hands. All right, I'm ready to discard that. And so there are a couple different things you can clean with. Evidence-based practice says chlorhexidine is best, but sometimes you may not have access to that and you may have to use alcohol. So I'm going to teach you how to clean with both. But if you have one of these in your kit, we want you to use this for checkoff. So for the chlorhexidine, you're going to pop these wings and tilt it down, and this causes all of your solution to go into the head. So this is what we're going to use to clean, and the technique that you utilize to clean with this is you are going to start at the hub and you're going to scrub up and down, and then you're going to go to your outsides, making sure you do not go back over the insertion site because you would be bringing bacteria to your insertion site, which is a problem, okay? I'm done with that, so I would discard. If you had to utilize an alcohol swab, you would open it up, and for it, you start at the insertion site and you clean in a circular motion outward, being sure you don't want to go back over that insertion site again either. Okay, now I'm going to let it dry. I'm ready to open my Tegaderm dressing. This patient has a trach in place, so I want to lie my dressing vertically, not horizontally, because we do not want this to get caught up in our trach ties. And Miss Braddock likes to say that the port here should be the star of your show. So that's where you want the center of your dressing to go over this insertion site, because that's what we are trying to prevent from getting any bacteria or infection. So we're going to lay that on there nicely. We're going to peel this off. This is kind of big and I don't want it over my trach, so I'm going to pull it down. All right, and then you have this little label here. We're going to peel this off, and we are not going to put this over our insertion site where we're trying to monitor for infection, okay? So we're going to put it more back towards this way or towards the side. The side would probably be best right here. So then I'm going to put the date, time, and my initials there. And then I'm just going to clean up my mess. I'm going to ask the patient if they need anything, lower their bed back down, make sure they got their call light in reach, and that is all.